Hi, everyone. Have you ever heard of a drug called Flakka? What is Flakka? Flakka is a stimulant drug with a chemical name synthetic cathinone alpha-pyrrolidinopenthiophenone. It is also known as Flakka, Gravel, Flakka, Cloud9, Bloom and Cosmic Blast. Let us take a look on the history of Flakka. Flakka was first patented in 1967 as a nervous system stimulant. In 2013, it was available in tablet form in the United States. So why is it widely used? Because it is inexpensive, causing people such as poor desperate drug addicts and homeless to abuse Flakka. It also can be placed in a cartridge for vaping. Thus, Flakka can be concealed easily in the public. This allows the abusers to vape it without any suspicion. Who tends to abuse Flakka? In 2016/2017, 0.8% of high school seniors in the US is estimated to have used Flakka. Students who do not live with their parents and students whose parents have less than a high school education are at higher odds for use of Flakka. How Flakka is used? It can be taken by eating, snorting, injecting and vaporizing in e-cigarette-like devices. Mechanism of action of Flakka. In our body, we have chemical messengers called neurotransmitters such as dopamine and norepinephrine which control our body movements and emotional responses. The neurotransmitters transmit signals from one neuron to another, before they undergo reuptake into the neuron for recycling. When someone takes Flakka, alpha-PVP inhibits the reuptake of dopamine and norepinephrine in the brain, causing the brain to be flooded with these neurotransmitters. The signs of Flakka addiction include spending large amounts of money on Flakka, neglecting family, work, or responsibilities, persistent thoughts about Flakka and not being able to stop despite repeated attempts. What are the short-term effects of Flakka? The short-term effects of Flakka include high euphoric or extreme happiness, frightening delusions, paranoid psychosis, extreme agitation, and lastly multitude of other altered mental states. What are the long-term effects of Flakka? The long-term effects of Flakka include exaggerated symptoms such as feeling of incredible strength, disorientation, aggression, altered thought processes, hyperthermia, coma, and even death. Now, let us look into the withdrawal syndrome of Flakka. The withdrawal syndrome of Flakka includes extreme irritation, severe cravings, a significant crash shortly after the drug is discontinued, mood swings, anxiety issues, sleep issues that can vary from insomnia to hypersomnia, crazy real-life incidents involving Flakka use. In Florida, a woman carved out her mother's eyes and displayed them on top of a box. In Miami, a man horribly attacked a homeless man and chewed off his face and eyes, leaving the poor man blind. A viral video of a prisoner who bit off a live mouse's head causing public outrage on animal cruelty. Management and treatment. For pharmacological approach, the patient is treated based on the adverse effects of the drug. Benzodiazepine is used for agitation and epinephrine is used to normalize the heart rate and blood pressure. The patient needs to be monitored for several weeks to ensure a full recovery. The patient may also be sent to an inpatient rehab. Inpatient rehab means the patient stays within a facility for the treatment. The chances for recovery in this approach is high because the patient is not exposed to his daily life that might put him at risk of abusing this drug again. Outpatient rehab is similar to inpatient rehab, except that the patient does not stay at the center but he or she has to come there regularly. This choice of rehabilitation is suitable for those who prefer to stay at home while seeking care. As a conclusion, Flakka is a very dangerous and yet addictive drug. Proper treatment should be given to the patients to restore their normal life. So, if you know someone who is an addict, do not neglect them. Instead, show them that you care and there is hope for them to recover.